Okay, thank you, everybody. So we looked at, you already heard me say today that I'm autistic. I got my diagnosis when I was 47, so that's 3 years ago now. And that certainly led to me understanding myself better. And I became really interested in the experience of other autistic veterinary surgeons. And the more I read into it, I found that poor mental well-being and an elevated risk of suicide was associated with autistic people. And that has also been associated with the veterinary profession as well. And so the combination of those two things could lead autistic vets to be at risk of high risk of psychological distress. So I wanted to explore that and look at understanding the specific workplace stresses experienced by autistic vets, with a view to being able to provide proactive adjustments with a view to reducing that risk of psychological distress. So the first aim of this work was to examine autistic vets' experiences of their psychosocial work environment. And psychosocial work environment is the planning, the organisation and the management of work. And they are modifiable, the psychosocial work environment, so it's something that we can do something about, and it has been linked, psychosocial work environment is linked to mental health within the profession, as in, the general population. We also wanted to generate a profile of mental well-being of autistic vets and compare that to normative data, to identify the workplace stresses of vets and to investigate associations of their exposure and mental well-being, and then to consider reasonable adjustments which might decrease that risk. So it was a mixed method study. We did a qualitative study and a quantitative study. So the first part was qualitative. It was interviewing 15 autistic vets that were in practice in the UK. And the first thing to point out is that autistic vets found it quite hard to describe what a good work day was. A good work day, the best or the most frequent thing that people said was the absence of bad things happening. And when we sort of tried to tease out more about what could make it a bad day, it was the most common thing was positive interactions. So this is a thematic map, basically. So thematic analysis of the transcripts was performed. The bigger the box, then the more people said it. So all 15 people said that positive interactions made a good work day. Of that, connecting with colleagues was more important than the client interactions. So the colleague reactions had greater weight. Feeling in control was also very important, and that was both with the work organisation, but also the physical environment. Physical environment can be very stimulating and overstimulating for autistic individuals. And then less frequently mentioned were having enough time and a sense of achievement. When we came on to a difficult work day, the most common thing that people discussed was professional interactions. And again, it was with colleagues that this was most important, not clients. Again, the lack of control was very important to people. And that was both with the time pressure of lots of work, but also just about unpredictable nature of veterinary work, and also the sensory overload as well. The physical environment could just be too stimulating. And then role-specific challenges played a smaller part. In the second part of the study, we looked at a quantitative survey of the profession, and we sent this out on social media. We had 106 responses. People could either be medically diagnosed or self-identifying. Of those, we had 85 usable responses. We looked at mental well-being using WEMWebs, You can score from 14 to up to 70. Over 60 is excellent well-being. And we looked at this compared to other populations. In our study, the mean was 39, which is similar to that of autistic adults. Those autistic adults are in Australia. There was no UK population with a WEM-Web score, so that's the best we could do. If we compare it to veterinary surgeons, the survey of the profession in 2019 had a WEM-Webs of 48, so quite a lot higher than our autistic vets. And that's similar to the general adult population in both England and Scotland. So the well-being of our autistic vets was poor. And actually, of these 85 people, 3/5 had a WEM-Web score which was indicative of major depression, and a further 1/5 indicative of probable depression. So 4/5 of these people had a likely diagnosis of depression. When we looked at generic job stresses, we used the Mean Standards Indicator tool, which is a tool which is developed by the Health and Safety Executive of aspirational management standards. And there's 7 different domains which we look at: demands, control, managerial support, peer support, relationships, role, and change. And survey participants answered this 35-item questionnaire with what those particular elements were, and the higher the score, the better; the lower the score, the worse the psychosocial environment. And we saw that the psychosocial work environment was very poor for autistic vets. It was below the 5th percentile for demands, and it was below the 10th percentile for all. In fact, it was only one of the standards which was at the 10th percentile. The others were at the 5th percentile. Demands was also very low with the general veterinary population, although I have to point out that that data is from 2007. We really need current data using this Mean Standards Indicator tool for the veterinary profession, because the only data we've got is from 2007 from David Bartram's study. But for the other standards, they scored much better than autistic veterinary surgeons. And the UK working population are higher again. When we looked at the variance, so how the well-being of the autistic vets was associated with those psychosocial working conditions, we found that it explained 44% of the variance in well-being, so a massive amount. Each of those individual domains was correlated with well-being, and together they accounted for 44%. The demographic data was only 1.4% of variance in well-being, so it really played a very minor role. That wasn't significant, whereas the psychosocial work conditions was highly significant. And the two that, the two that came out most significant were control over the way that work is done, and clarity and absence of conflict regarding role. They were most strongly linked to well-being. Now, this is important because actually these two factors were also found in David Bartram's study with general veterinary populations. So if we actually focus interventions on these two particular areas, then we will be helping not only the autistic veterinary population, but actually the general veterinary population as well. One of the most commonly cited things, and why so many of those professional colleague relationships were difficult, was because participants felt that there was a great lack of neurodiversity awareness within their colleagues, and they didn't understand, well, they often didn't even know their colleague was autistic because the person didn't feel able to self-disclose, but also they were just unaware of how stimulating the environment would be, or maybe how communication differs between autistic and non-autistic individuals. And so they were taken the wrong way, and people were offended by things they might have said, which they didn't mean at all in an offensive way. We also looked at veterinary-specific job stressors, so things like euthanasia consults and things like that, but they actually really weren't significant at all. It was all the more generic stuff like communication and the environment that came up as significant. And the more veterinary specific it was, the less important it actually was as a factor. We asked people to suggest what they thought would be good interventions, and we also asked them to rate some interventions that we thought might be useful from the first part of the study, the good and the bad workday interviews. And the things that were deemed most acceptable were a dedicated workspace, an area that they could control, and they knew where things were. And, it's not rocket science. They wanted sufficient and restful breaks, So things that lots of people, every vet would probably want. But the key there, restful breaks, people found staff rooms very, very challenging. So for an autistic person, that might be just a quiet room on their own, and to be accepted that they weren't being socially inept or rude by going and seeking personal space. And neurodiversity and disability training for all staff was the third most popular intervention that was rated acceptable. Thank you very much. If you're interested in reading our paper, it's freely available, open access in the vet record, and I'm very happy to take any questions if you have any.
Thank you. Would you please join me in thanking Kirstie? Does anyone have any questions? Yes, just
Is there any work on autistic and ADHD vets, or is that a step too far?
You mean with both diagnoses?
Both, yeah.
So the interviews that we did at the beginning, we excluded comorbidities because we wanted data very specific to autism, but actually in that second study, the quantitative survey, you could have comorbidities, so that could be, you could be ADHD and autistic in that as well.
Okay, thank you.
Thank you. Anybody else? Yes, James.
Kirstie, do we know or have evidence for the level of neurodiversity among not just vets, but practice staff?
No, we don't. It would be very difficult to achieve that, largely because there's probably vast numbers of people who don't know. There's a huge proportion of missing women in particular, so it would be very, very hard to get that data. Yeah, the prevalence in the population is quoted at 1% to 2%, but equally, everybody says that that is totally outdated prevalence figure. The diagnostic criteria are actually totally out of date because they're, and this is widely acknowledged by the medical profession, because they are very old traditional model of what autism is, and based around the male presentation, so, which is one of the reasons why so many women have been missed.
Thank you. The final one just in the middle. Thank you.
Thanks, that was really interesting. I was interested to see the difference between the impact of client interactions versus colleague interactions, because I think I would have assumed that it would have been the other way around and that client interactions would have potentially had more of an impact. Did you have any kind of suggestion from the interviews as to why that was the case? Was it because colleague kind of relationships were sort of longer lasting and I guess more present in sort of day-to-day work, or?
Yeah, very much. And certainly from my own perspective, when you're in the vet-client relationship, you're playing a role. That's easy for me to do because I'm in that role and I'm giving advice, and I work in university. Again, I'm playing a role, teacher to students. That's easy. It's communicating about the everyday stuff to colleagues that I find really, really challenging, because it's social communication more than transactional communication that's often very difficult, and it would be things I would say would be taken the wrong way. My sort of awkwardness or shyness around wanting, I have no interest in small talk. So, before my diagnosis, the nurses said that I was aloof and standoffish because I didn't want to chat about what we'd done last night. But actually, I'm not interested in well, if I met you for a drink or something, I might be interested in that stuff. But when I go to work, I'm there to work in my head, like let's get the horse out of the stable and do endoscopy. That's what I'm focusing on. And I think all that small talk is not for the workplace. So, I have these rigid rules in my head that I expect other people to conform to, and they're expecting me to conform to their, what I would call gossip and chatty stuff.
Thank you very much. Thank you,
Thanks.
Kirstie.